What happens when you enter a hospital in America? As an internal medicine hospitalist, I have taken care of numerous patients that seem to have no clue about what goes on in a hospital. When you enter the emergency as a patient or a caregiver, you are first evaluated by the emergency medicine physician or a provider. They assess your symptoms and vitals, and based on those assessments, they order initial lab testing or imaging, whatever is warranted. Once they obtain the results of the initial workup, they make a decision whether you are stable enough to go home and follow up with your primary care physician, or if the symptoms or diagnosis is urgent enough to be admitted to the hospital for further workup. If the issue seems to be something that needs to be addressed immediately, then they call the internal medicine physician to come and admit the patient. Internal medicine physicians do a thorough assessment of all of your symptoms, system by system, and look at the lab work that was previously done, as well as the imaging studies, and try to come up with a diagnosis. And if it's not a clear-cut diagnosis, they may end up ordering more testing. But if it is a clear-cut diagnosis, they will start you on treatment immediately. If deemed necessary, they also reach out to consultants who are specific to a niche so that they can provide their assessment and give advice on treatment plans. Once you start feeling better after the treatment has been provided, internal medicine physicians are the ones that discharge you home so you can follow up with your primary care as well as other consultants if needed. So the next time you are admitted to a hospital, make sure you know who your internal medicine physician or provider is, because they are the ones actively making decisions for you. Stay tuned for more such insights.